Okay, I've just got back from my pre-op hysterectomy assessment, and it's going to be at the Princess Alexandra NHS Trust on the 26th of February. The nurse was really nice and treated me just normally and didn't once make me feel different in any way, shape or form. She didn't even once say about being trans or anything. We went through stuff like, you know, my health and things, which is perfectly fine, and then she said about the operations I've had before, you know, double mastectomy, and then she went through this, which is your inpatient surgical journey. She said I need to bring some towels because of bleeding, and bleeding can last up to 6 weeks after. Went through this, which is your inpatient surgical journey. She said I need to bring some towels because of bleeding, and bleeding can last up to 6 weeks after. She asked me when was my last period, and I said, well, I think that I've been on testosterone coming up 5 years in, yeah, I think it's 5, not 4. I'm sure it is. Yeah, it is 5 years in May the 16th. So for just under 5 years, I haven't had bleeding. So she said we'll bring some sanitary towels. She said on the 25th, which is the day before, well, first of all, she said that I qualify for, your consultant has made a clinical decision that it's appropriate for your surgery to follow an enhanced recovery programme. Which means that I drink this drink, which is Nutritia. I think it's just packed full of nutrition pre-op, lemon flavour. Right, okay, drink that on at 9 o'clock. Drink that the night before on the 25th, and then shower. I can't shower because I don't have a shower, but I'll have a bath. And then I have to put up this suppository after my shower, lay on my left side for 15 to 20 minutes and put that up. If I have opened my bowels during that day, then not a lot will come out. If I haven't, then just make sure that my bowels are empty for the next day for the surgery. And then on the 26th, which is the day of my surgery, at 5:30 in the morning, I have another one of those. I could be out on I'm going in on Thursday morning. I could be out on the Friday morning of the operation. I will have a catheter. I will have a drip to get fluids into me, and the anaesthetist will talk to me about pain relief. Yeah, and I will have a drain, that's right, as well. So I'll get someone to pick me up and then I'll come home. A friend of mine is going to come down from Liverpool and stay with me from the Monday to the Thursday. And before that, I have some friends locally who will pop to see me to help, you know, if I need some help with stuff, because I live alone. And if I was to have an incision, then would I be in there longer? And she said, if you were to have an incision, then you probably wouldn't go home to the Saturday morning. But she also said that if anybody can do a laparoscopic hysterectomy, then my surgeon can, because she's one of the top people doing this procedure, which for me, I realised that prior with the research that I'd done, and the friend who recommended this surgeon is not trans, but it's an old family friend, not old as in, I mean just from years, she's known me as a baby. So she highly recommended her because that's her gynecologist that she sees privately. yeah, so I feel absolutely 100% in safe hands, and I have respect for the person that's going to do stuff to me when I'm unconscious. So yeah, I think that's important. Yeah, so everything's lined up. I feel very happy. I asked about maybe taking some stool softeners before the surgery so that I wouldn't feel blocked up, but she said that as long as I go regularly, everything should be fine. She said that because during the procedure they blow your stomach out to do this, then this is the nurse that told me this, the pre-op nurse. Then what I might experience is pain in my shoulders, all around here, pain because the wind, some of the wind gets stuck and travels up, but that's only a might, and if I do, it will last for between 2 and 3 days, and then it'll go anyway. I said, what about the possibility of an infection and what I would do if there was an infection? Not that I'm intending there to be one, and I'm certain that there probably won't be, but just in case, I like to be as informed as I can be. She said to just, if I feel that I've got a temperature, or that the incision area, around my belly button, gets inflamed or looks red or swollen in any way, to contact my local doctor and to go and see him there, maybe get some antibiotics for that. But I'm not thinking that will happen at all. I really have many emotions to process. I'm a 47-year-old person, and the thought of reproducing has never been an issue with me. I don't have any children, but what I'll do, I'll make another vlog before, sometime between now and before my hysto, about that side of it, and also I'll make a video as soon as afterwards, a few days afterwards, and yeah, it's kind of the end of a very long journey for me, this procedure, and yeah,